I promise I won't drop you.
Alright.
So don't fight it. Just let everything relax.
Okay.
There's 99% of it. There's the rest.
And
Nice, brother.
sweet. Autumn.
You are here this evening because you have some serious back pain, according to the intake over there.
Yeah.
And we spoke on the phone. Neck pain as well.
Yeah.
When did it start? Was there a significant injury? Tell me all about it.
It started, my neck injury started at 16 I know exactly what it was from. It was from sleeping wrong on my bed.
Mm-hmm.
That's how I like sleep on the side, and then I do this thing where I crack it, and I know that from the little knowledge that I know about your field, is like there's joints and stuff, and it moves the joints around. So it's been a couple years, about 6 years for my neck, and then my back. It's been about 3 or 4 years from working in a warehouse lifting stuff, and then also from bad posture, sleeping, and just not caring about how to pick things up, and so yeah, and it's gotten to the point where like I'm like an old man, like I'm at that point where I'm like, man, I'm scared for my youth, you know.
And how old are you?
23.
23. So you're really young.
Yeah, it's like I just played football with a friend, like just throwing a tiny like little football, and like just barely jogging. Like we were playing tackle football, which I should be able to do, like, or any young guy, I assume. Not all young guys.
What is the most uncomfortable position for you to be in? Like, what position are you in where it's like throbbing and it really starts to be disabling?
Anything bending down when I'm standing up, but any type of bending. If it's like when I get in my car, like sharp pain on the middle leftish side of my lower back, and just like anything now. It was really bad from 2 days ago from playing football and all that. But before that, it was like a 6 out of 10, and it was bad. Like I was like, I can like move and kind of be agile and kind of put my shoes on, stand up. Like, but now it's like I have to sit down and like be like this and like super like over the top. Yeah, to try to like.
Because you're protecting I mean, it's very like the innate, right? Like our body's innate intelligence is protecting us from getting further damage. You know what I mean? And you're feeling that, and you're moving cautiously, which is good.
Yeah.
But we don't want that to have to be your life, obviously.
Right. Yeah. Thank you. Yeah. Even like to now, my shoulders I feel throbbing in my shoulders now, and I understand like your muscles work to like cover, like if one muscle like one weak link, then they overcompensate to cover that. I get the idea at least, and so that's kind of happening. But yeah.
Have you ever had any imaging done in the past?
Like 2 years ago, I came for this same problem, and because I was scared it was gonna get worse, and I went in with like a coupon to some random chiropractor, and like he took my X-rays and don't even know where they went. Wasn't mature enough to like ask where they were going or anything, and so not really, no.
Did you find any relief from the adjustments?
Not with that guy, but I went to the joint about 2 days ago, and there's this guy that it did help. But as soon as I went to like do an easy activity, it kind of went back. But that's not to say that he didn't do a good job, because it did help initially. Yeah. And I don't know if I didn't just know to take care of myself better, like not to go do crazy stuff after an adjustment. Right. So kind of stuff like that is kind of my responsibility. So.
Okay. In our spinal cord, really our spinal column protecting the cord and all the nerves, we have the discs in between here. Yeah. Now, you working in a warehouse and being active, and especially nowadays where just, 2 generations ago, like people in their 40s, they just didn't sit as much as we do now. Right. Now, we're in you're growing up now, being in your young 20s, it's in a generation that's very technologically savvy, very comfortable with technology, and a lot of that is because we are coming up in this world where we are sitting down a ton more. Right. And the bottom line is, what it's done is it's affected the natural lumbar curve of ours, like this, and it's kind of put us in this open pack position to feel good when we're sitting and alleviate some joint pain. This is actually what we would call this like a flexion tolerance. but you're developing a flexion intolerance by being in flexion of this lumbar spine.
Yeah.
And these joints being open make the joint feel good, but the problem is, see this little red thingy here kind of acting like a herniation?
Yeah.
You're losing your curve here, and more than likely we have some discs that are aggravated.
Yeah.
Aggravation is kind of the same that I chalk it up to as like the annular fibers being torn. So these are called annular fibers. They're these little oblique things that are all the way around our discs. And those fibers are packed with pain receptors. It's why it's like, ooh, 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 before you get into that position to where you can even put on a shoe.
Right.
So right now, what we're trying to do, more than likely, and I'll find out with my exam definitively, we're trying to get it to where this disc doesn't burst through and trigger this nerve to where it really becomes a problem.
Right.
And it's interesting, not interesting, but it's mature of you to say that like when you went to the joint, you got temporary relief, but maybe you did something too strenuous.
Right.
It depends, because when we get the adjustment and we get increased motion, the mobility point of it, it is going to be your job then to do some exercises to create stability. Those might be just lying on the floor on the stomach, creating the lumbar curve.
Right.
Some of it might be some things called bird dogs. It's like opposite hand, opposite leg, where like you just work on that core stability, doing things like avoiding things like sit-ups and crunches, and sitting for too long without stretching and blah, blah, blah. We'll get into all that.
Okay.
But if you can conceptualize that it's so important to inhibit the pain and get the joint to get like the pressure off the nerve and kind of feed the disc the nutrients it needs to be healthy, and then work on the stability portion, you can rehab your back to have like longevity and health in your back. The only thing the x-ray is going to do, well, it's going to do two things. One is it will definitively tell us the position and quality of the disc space, the position and quality of the bone in rotation, and the just overall condition of your bones for your age, right?
Okay.
And then we'll know the curves and the compensating factors, which will lead us even to, down the road into more of what I call a fascial distortion, which is also super important when it comes to adjusting.
Okay.
So if you understand like that, then you know what's going on here, because it's the same thing that's going on up here in the neck.
Right.
Too much sitting at the computer, creating that open pack.
Yeah.
Disc gets aggravated, begins to stretch.
Yeah.
Irritates the nerves on one side or the other, depending on what's compensating. Boom, you've got yourself what we call a subluxation, right?
I noticed whenever I'd go to the gym, I would I saw this and I thought about I would hang on a bar. Yeah. And I would let my hips just fall. Yeah. Almost disconnect from my back. Yep. And it would cause nerve pain to shoot up. So I was just wondering to hear an explanation, and I was just curious as to
this illustration might be a little bit easier to know. When our disc here begins to bulge in the back, yeah, even if it's not bulging, even if it's just irritated, those fibers, those annular fibers are irritated, there's a certain amount of misalignment, if you will, of the disc, not even the bone. Yeah. So what happens is when you hang from your when you hang from your arms and you let the leg go down, and it basically is tethering at this point, it's touching one of these nerves, right, because of the way the disc is moved in that position. Okay. So if it's a little bit more medial or midline, like in here, yeah, and then you go ahead and try to hang down, that nerve root actually will touch that disc going down. Makes sense. However, if you have a more medial bulge, like we just mentioned, and then I pull, from the head, right? Pull from your head up, like you see the Y straps and stuff, right, the ring dingers. Yeah. That type of tension will actually pull off the nerve root over here and create decompression, and you won't feel the nerve shoot. You'll just feel like temporary, maybe some ligamentous pull. Sure. But it would take the pressure off where that nerve root might be irritated.
So it would not shoot done properly. I wouldn't have shooting pain let's say a few weeks from now, or as it was done, if I were to hang on it, going through the process of what you know. And
based on what you're saying, with the medial disc bulge, more than likely being what's aggravated if you're hanging up like this, that medial disc bulge, yeah, if we can diagnose definitively and know how to adjust that, when we make the adjustments, it should not aggravate it as much. It shouldn't be shooting pain.
Right.
It should start to free up.
Cool. It's great news.
With the chin going down again, just to where it's like beginning to get a little uncomfortable, I want you to let this foot come up. I'll do it and just tell me if it causes too much discomfort, I'll stop. But does this make anything better or worse? Same?
It's starting to hurt my lower back now.
Okay.
Yeah.
On the left side?
Yeah.
Or both sides?
Mainly left, kind of going into the middle and right.
Okay.
Yeah.
And now, from the same position with the head down,
Okay.
where you're feeling that same tension on the right.
I don't know if I inherited it. No, I'm just.
Hey, you know, one of the big patterns that we find is somebody who has a lumbar disc problem, like where you do,
Yeah.
is the mid-back starts to really act up from a compensation.
Definitely. That's like to the T what's happening with me, at least, is that my middle back is like super tight all the time.
And what will happen is that compensation or whatever, I mean, it's a subluxation, it gets adjusted at some point. But for me, and I always talk about this is to all my patients, is adjusting in patterns. Because we could hit a home run and get it right the first time and give you like a lot of relief, and you're just like, okay, now you're wellness, you know? It's coming when you need an adjustment. I mean, we live our lives through our spines, whether we want to admit it or not.
Right.
But that's where like all, you know, activity comes from. With the nerves that innervate our muscles, or the nerves that come through and that are being aggravated by the disc, those are the same nerves that lead to every organ and gland in our body too.
Crazy.
So urine imbalance, or your frequent urination, if you will, excuse me, GI distress, constipation, all these things, all these reasons why we have like a dysfunction.
Sure.
That's why like, getting adjusted proper makes it better. But where I was going with that was the compensation. So finding the right patterns is almost always what gets people like the most healthy.
Right.
What makes their pain go away like the longest. Now I can even tell you right now, just feeling here,
Yeah.
you know, a little compensation and some tenderness right here, and this might need to be adjusted just to take some pressure off the spine.
Yeah.
But the majors right here.
Yeah.
And then this is just like a huge reading disc problem. So what we're gonna do is called the forward bending test, because I gotta see which sacroiliac joint might be involved. So just scoot forward a little. Okay. So from here, you're gonna bend forward like you're gonna touch your toes. Obviously, you're gonna go careful. Keep on going. And come on up.
Okay. Yeah, it hurts. It hurts on the way up.
Well, this right sacroiliac joint's pretty bad. So right side high. So now knees together and feet together.
Okay.
And you're just going to open and close your knees with your feet planted. Kind of like fanning them open and close, open and close.
Okay.
So go wider. That's good, and keep going faster. Open and close. Yeah, just like that. You got it. Keep going. Now left only. And right only. Yes, sir. This right SI joint's no good.
Gotcha.
Which means even though you're having pain on the left, and I want to adjust the left, I think we're going to have to adjust this right side to start.
Wow. Yeah.
And then this right here, there's quite a bit of torque in here. So we got to find the right way to unlock this. I can already see it's going to be this way. Okay, man. Well,
dude, you're like a guru. Yeah, this didn't happen with the other chiropractors at all.
yeah, no, this is, I mean, I appreciate that compliment, and like, don't get me wrong, I'm gonna do my exam's gonna take longer than the adjustments. Even when you come in for follow-ups, you'll see like tonight's, you know, a long, nice session. We get to know each other. I got to know exactly what's going on with you.
Yeah, thank you.
You know, I want to trust you. I want you to trust me, and we're gonna work, and we're gonna get you out of pain. Like we're gonna do it.
Yeah, thank you.
This is your right side. Right. There's nothing that stands out in terms of the bone quality from this image, though. I will show you something when we look at the lateral.
Okay.
However, this says ASEX. That's Gonstead annotation for anterior, like it's anteriorly risen, and externally rotated, meaning your pelvis is slightly rotated this way.
Hey.
And the reason that happens, or the reason we know that, is because we draw that line dead center down the middle of the sacrum, and this part right here crosses over that pubic bone.
Okay.
This one's more narrow over here because it's internally rotated. It's starting to shrink this image because it's rotated again back in this way.
Right.
And that's posterior and inferior. And we know that now because the lumbar spine bows a little bit this way, creating a stretch on this side and a compression on this side. And the rotation's done what it's done, which a little bit more of your symptomology is on the left side, and that's probably more of a muscular strain. But when I was doing some tests last time with you, I noticed that this right side, the leg couldn't really extend quite as far, or it just had a habit of staying slightly bent. That's probably because there's a tight nerve compression, and it's also why when we did all that palpation, we ended up adjusting this right side first.
Right.
But you have more of a compression on this side. And that compression that's happening here on this part of the lumbar spine, as opposed to it being open here, it just means that this muscle is stretched so far, farther than this doesn't do it justice. Because over here we see this is 241 millimeters, 237 millimeters. So let's just call it 5 millimeters for the sake of math, because it's like 0.92. That means that this is a longer distance here, this is a shorter distance here. We have stretch on this side, and we have, again, compression on this side. And we know because this drops down, this goes out. That's like an anatomical law.
Wow.
So that's just kind of definitively how to correct the pelvis. And you'll feel that today with the way I do the adjusting, depending on what we find in the palpation when I do the stuff in the back of the chair with the scope. What doctor would ever say, like, well, good disc space, there's no pathology, like, what do we do? Like, nothing, you know what I mean?
Right.
However, like me, like I went into a career to do this Gonstead work, this is important to see. Here's L5, here's L4, here's L3. Here's your sacrum, so the base, right?
Yeah.
You do have decreased disc space here. You can just tell if you look at the black shadows here. See these like big black shadow?
Yeah.
Big black shadow, kind of fainting black shadow, and then almost non-existent black shadow.
Yeah.
So that L5 S1 disc space is pretty closed off for being as young as you are.
Right. Is that is there hope for that person's spine or anything?
Yeah.
Like,
There's hope. I would say the most troubling thing from this lateral view is, one, this sacral angle is good. This is what we call a lumbosacral angle.
Okay.
So this is good. However, there is no curve here. If I could adjust and you start to move better and then naturally through some exercises just even get 12 to 15 degrees through this, that would be a lot better long term for your lumbar spine. And the truth is, only the X-ray would show this. 5, 4, 3, 3 on 4 is way too low. This is too narrow.
Okay.
This should be the size of this, and it's not. This should be bigger. For your age, you want to see more space back in that L5S1. However, it is the most common early on degeneration.
Yeah.
Just the angle alone will show that it's a little bit decreased space. But we're going to possibly, maybe today even, have to correct this third lumbar. That is just not enough space.
Yeah. So you actually, like, I know you do, but like it's crazy. You have the skills to actually fix that.
I have the skills to adjust it the most appropriately,
right,
so that the neurology reads it based on the mechanics functioning properly.
That makes sense. Yeah.
And when the mechanics function properly, the neurology is happy, less pain, better function, recovery.
Right. Like you can set the computer system up
exactly
so that like it knows what to do. Yeah.
Yes, sir.
It's crazy. Yeah.
We got to re-engineer some software. I started to send this cascade of events into trouble, I guess, is for a lack of a better term. And I'm just going to go ahead and kick this down. Nothing to fear. Fear itself. That, I title that a podcast or something.
A writing.
That's it right there. Nice breath in. And all the way back. Let that stomach really, really drop. That's it, buddy. Wow. That's how you do it.
Man, it's crazy.
That's what we need right there for that muscle.
Wow. This is really an art.
Oh yeah. Oh, look at that. Chiropractic. What do you call it? Science, philosophy, and art.
Yeah.
I'm gonna raise this table up now. Don't worry, you don't have to do nothing but enjoy the ride.
Oh, thank you. The real deal. Seriously. I appreciate it.
Oh, for sure, man. So now you're gonna lie on your left side, facing that way.
Okay.
I feel good because it's gonna open up off that disc.
Okay.
I'm gonna put you in a little more extension like that.
Okay.
So the goal here is, instead of adjusting this, which we are going to do probably the next visit,
Okay.
I'm going to use this bone, this ilium bone, as a lever.
Okay.
And you're going to feel that open here and all the way down here.
Okay.
So I'm going to really pull like that.
Okay.
Let everything relax. I promise I won't drop you. Okay. Good.
Man. Sweet.
That was a good start too. It's a little better than I thought. So go ahead and use this hand to push off here, and you're going to walk around.
Okay.
That should feel pretty
It does.
relieving.
Yeah, it really does actually. Yeah, like this doesn't hurt. I don't know if this was what was supposed to happen, but when I've been down, it doesn't even. It hurt. Like it almost doesn't. Like it. Like I don't know how to explain it. I'm not. Yeah. It doesn't. Yeah, no, it actually does. I'm not saying that for the camera. Yeah.
Okay.
It feels really good. It's crazy.
Good.
Yeah. Appreciate it.
Yeah, no, that's good, man. So go ahead, sit on down here.
All right.
I'm just curious to see how does it even feel to sit down initially.
Yeah.
If it starts throbbing or if it just feels better right now.
Yeah.
Let's go ahead and motion a little bit.
Yeah, that doesn't hurt at all. And a little bit when I go forward, but nothing like when I go back. That's crazy. Seriously, I appreciate it.
Oh, that's what I do, dude. Oh man, I'm telling you, like I exaggerate not. In a life full of opportunities to exaggerate,
Yeah.
there's like no reason for me to. Just going to give him a shout out right now. Dr. Doug DeCubellis in Providence, Rhode Island. Man, saved my life. Best chiropractor on the planet.
From like self-experience.
From experience and being. That's not really stuck. Chronic neck poppers almost always have a stuck occiput.
Yeah. I'm the lucky one.
Yeah. It just isn't showing up yet.
Yeah.
And then the other place would be down here in this region. So let your head relax and we'll back off. I think that's what we gotta do is start up here on the left and then, yeah, it's the only thing that's showing up. So let's get you your first proper Gonstead neck adjustment. Let's go ahead and scoop forward a little bit more so you're lower in the chair, just butt goes forward, so you can lean further back.
Okay.
Yep. Hands on your hips, or on your waist rather.
Okay.
And nice and relaxed. Right on this atlas bone. And then what I do is I motion the head, that way it's easier for you to relax.
Okay.
And then I'm just gonna make it like this, so you just let it drop into my left hand, completely drop it. And I've already said a little, let it go more. Even more. Wow. Yes, sir. It was kind of an easy adjustment, but also the only one that showed up today. So it's a good start.
Yeah, for sure. Thank you.
All right. So yeah, man, what I'm gonna do now is I'm gonna shut off this camera. I'm gonna go over with you some stabilization exercises, and we'll talk about getting that x-ray for the follow-up.
Okay.
And just kind of walk around, see how much better you do.
Yeah, like even now, I could never do this before. I promise you, like I could never do that. Yeah.
Yeah.
And I'm afraid to ruin it. I'm afraid to like go in the car, or like like I'm afraid to ruin like the.
So here's
goodness. Yeah.
So here, you know, okay. I'm glad you brought up a lot of things that I used to talk about as a patient, but also now as a doctor that I think this is what you don't want to do. And actually, you being a DJ and doing a lot of beats and music,
Yeah, kind of having to sit down
and pivot.
Yeah. That was the worst for me. Like I can't
Yeah.
And like now I kind of can. I can. Yeah. It doesn't hurt.
That's actually going to be, I think, the biggest challenge for you, and it's one of the things you're going to have to start kind of putting away in the memory banks from tonight is you need to get like a swiveling chair if you don't already have one.
Okay.
One that even like this, without arms or whatever, right? That swivels.
Yeah.
Because you have to actually avoid doing this. You need to be able to not aggravate the disc while you're in like what should be a neutral core position.
Right.
So say you're here and you're like, oh man, got to get my beer tonight, and you make that reach.
Yeah.
Or that reach, that could be devastating.
Yeah, and it is, because when I do that, it really hurts. Yeah, any type of like motion, or if like I pick something up over here, or like it is like excruciating. Yeah, but it doesn't hurt anymore, and I'm not gonna go like think I can just, like you said, just take care of it right now.
Yeah, I mean, it is definitely a process to get to that point, and what you'll find is over time, as I take your seat, right? What you'll find, what you'll find over time is, you'll have moments where you can do it, and you'll have moments where you just can't, and a lot of it has to do with just kind of being taxed.
So my back has been really bad the past 2 weeks, and due to like activity and stuff, so I could barely move, and it's been a whole lot better the past 2 weeks, like tremendously, like just off that one adjustment, And
all the stuff we looked at on the X-ray right now is popping up here.
Yeah.
And here's going to be like a little chronic one, but now watch this swing right there and back. T6. Which one's more tender to touch? I'm just curious. 6 or 7?
Definitely 6. Okay. Yeah. Like I feel it squish into my muscle more, if that's what you meant. Yeah. Like tender, yeah. 7 is fine.
6, 3, ASIN, recheck. Nice breath in, and all the way out. There we go. So this is going to be PR as well. Stomach really drops. There you go. Can you move your pelvis forward, like just kind of like tilt your? Here you go. That'll work. That will work, my friend. I promise I won't drop you. So don't fight it. Just let everything relax. Okay. Just let everything relax. Okay. There's 99% of it. There's the rest.
And
nice, brother.
sweet.
Come on.
Damn. Feel good. Yeah. I feel more freedom. I would say freedom. I wish I had more like self-awareness to give like a better description. But
first off, I mean, did the adjustment feel good?
Yeah, no, it did. Yeah. No, it feels more free. I feel like I have more movement. I don't know if that's what's supposed to happen.
That's exactly what's supposed to happen. It's supposed to, like, the adjustment should feel like relieving with all the cracking, crunching as the pressure released from the joint. Yeah. And now if you feel that more freedom, like if you can bend and move more free, that's
definitely
the increased functionality.
Right.
And now that's what the neurology wants. Your brain is like, okay, I have more freedom. I can move the way I'm supposed to move. Okay. There's less pain. I don't have to guard as much, which can be dangerous. Like we talked about that, like on the chair and spinning and swiveling and reaching, getting in and out of the car. But just having that freedom, just having that being mechanically correct, it's now healing, and it's not worried about it. Like whether you're worried about it or not, your brain feels better. Like your brain knows the difference. Your neurology knows that mechanical, this joint is mechanically moving better and functioning correctly.
That makes sense.
So
Yeah, I do feel a lot more freedom. So
good.